Hello, everyone. My name is Heather Massaroni. I am a current occupational therapy student working on my capstone on increasing inclusion in Colorguard for performers with special needs, specifically through coach education. So during this presentation, we'll talk about the importance and benefits of inclusivity. We'll touch on some adaptive strategies and techniques specifically related to Colorguard. We'll go ahead and analyze some case studies to give a real-world example. And by the end, the goal is to increase your knowledge and confidence on the topic of inclusion within Colorguard. So before we jump in, please go ahead and scan this QR code to complete the pre-survey. It should only take about 5 minutes, and it's just to let me know how effective my education was for you guys. So go ahead and pause and do that. Okay, so jumping right in, what is inclusion? So 1 in 5 children, about 20%, within the US has special needs. However, children with special needs are reported to have less participation in sports and activities compared to their peers. So inclusion is enabling participation for all performers despite any differences in ability or identity. So within Colorguard, this means helping performers of all abilities participate and perform to the best of their ability. So the benefits of inclusion. One benefit is increased self-efficacy. This is the belief in your own abilities and skills. So with increased self-efficacy, you see higher confidence, more motivation, and a higher drive to practice and to learn new skills. You also see an increased social participation and acceptance. This means team acceptance and feeling as a valued member of the team and having meaningful participation. And then you also see an overall increase in quality of life for both the coaches and the performers. This is due to increased social participation, increased self-esteem, and confidence. So the Just Right Challenge. This is the perfect balance between being able to achieve skills, but also being pushed just outside of your comfort zone to promote growth. So as a coach, it is your goal to promote this Just Right Challenge, to promote growth within your performers, but not to the point of frustration. So this Just Right Challenge can change over time. This may be due to changes in experience or changes to the body, such as injuries. Maybe they have a flare-up, they're having a good day or a bad day. So it's just knowing your performer and communicating with them to make sure you're achieving this Just Right challenge. So we'll go ahead and jump into some common diagnoses and medical equipment you may see. So it's important to have a foundational understanding of special needs. However, just keep in mind that everyone has different experiences and different difficulties, even if they have the same diagnoses. Therefore, communication is key. We also want to have a strengths-based approach. This means that you're recognizing what an individual can do and where their abilities lie, rather than focusing on the things that they only have difficulty with. So having that positive growth mindset. And then your responsibility ultimately as a coach is to support participation in Colorguard. You're not expected to be a medical expert, and some of these things that we go through might be new concepts to you, which is totally fine. As a coach, your job is to ensure safety, know who to go to in case of emergency, and know who to ask for clarification on medical concerns or questions. This may be the performer's caregiver or parents. So autism spectrum disorder. This is a neurological condition characterized by deficits in social communication and interaction, the presence of restricted and repetitive behaviors, often called stimming, or repetitive interests and activities. So this varies greatly from individual to individual, so make sure you're, again, communicating with the performer and their caregivers on what needs they may have. Within Colorguard, you may see some difficulty with expressing emotions or frustrations. Difficulty being in a loud competition or gym environment. Maybe some difficulties with social interactions or interacting with their other team members. And then difficulty being within new or overwhelming situations. This may be going to a competition they've never been to if this is their first time doing Colorguard, or just rehearsals in general. So cerebral palsy. This is an overarching term that describes a group of permanent neurological disorders. They can affect movement, strength, control of their movement, posture, sensation, and thinking skills. Due to the overarching nature, uh, CP can vary greatly from individual to individual and also depends on the location of where the injury is within the brain. Within Colorguard, you may see some difficulty with balance and posture during movement. You may see some low muscle tone or strength. This can impact endurance or the ability to use heavy equipment. They may have some difficulty remembering or learning new choreography, and then difficulty achieving new skills due to difficulty understanding the movement of the body. Oftentimes with CP, we have difficulty with motor control and planning, which means that the brain has difficulty processing how to move the body essentially. Down syndrome is a genetic condition where an individual is born with an extra copy of chromosome 21. This can affect development, including mental, physical, motor delays, muscle and joint weakness, and coordination difficulties. So within Colorguard, you might see some low muscle strength and hypermobility. This can impact their strength, their endurance, their flexibility, and their balance when performing or using equipment. They may have trouble with grasping, which is holding onto the equipment or using heavy equipment. And then they may have some cognitive challenges which can affect memory or learning or remembering choreography. And then some other categories of impairments. Sensory impairments may include sensory processing disorder, sensory aversions, or difficulties with hearing or vision. Orthopedic conditions include limb differences, the use of prosthetics or orthotics, arthritis, or trauma and injury, which may also be more of an acute onset. If a performer has an injury or trauma, they may need additional support now, but may not need as much support once they heal. And then neurological conditions can include stroke, traumatic brain injury, spinal cord injury, and epilepsy, which is seizures. So some common medical equipment. We have a powered wheelchair. This is a mobility device. It is powered by a motor, so it runs on electricity, and typically it's moved through a joystick or another like visual system or a sip and puff system. A standard wheelchair is also for mobility. However, the person either propels themselves by pushing along the wheels, or they need assistance from someone else pushing them. You may also have performers with service animals. The most important thing with service animals is to never separate the performer and their service animal. It's also important to know what the alerts look like for the service dog so that you're aware of when they're alerting and who to help the performer out. And then orthotics and braces. This can help with mobility, posture, with any injuries. It's important that the performer be able to wear these as their medical provider has told them to. So make sure that it works with any equipment or any costumes. And then communication devices are used for individuals who may not be able to verbally communicate. Some may look more like an iPad and are electronic, while others are more of a physical paper pencil situation. The most important thing is that you never separate your performer from their communication devices. If you do so, it's essentially taking away their voice and any ability to communicate with you with their needs. So assessing the need, how to determine what adaptive strategies to use. So asking questions is the biggest recommendation I can give you. It's a collaboration between the coach, the performer, and their support system. This may include their parents, caregivers, teachers, therapists, or medical support. You always want to make sure you're checking with your performer and their parents about who to best discuss with. You also want to be aware of the setting when you're asking questions to your performer or their caregivers. You want to make sure it's private and that you're including all necessary parties. This means that if your performer is a minor or if they have cognitive delays, that you include their parents and make sure they're there. And then environmental factors. You want to make sure that it is a private setting. If you know your performer has different sensory needs, maybe make sure that it is a quiet environment, maybe dim the lights, make sure there's no distractions. And then some sample information you may want to get. You want to include what their goals are, what their interests are, any areas of concern or areas of support they may need, and their experience with Colorguard. A great practice for all performers, regardless of their needs, is to have an intake form. The intake form may include emergency contacts, any relevant medical conditions or medications they want you to be aware of, and then who else to contact in case of emergency. The biggest thing is to use your support system. So rely on the knowledge of the performer and their caregivers. They are an expert on their bodies, and oftentimes they already use strategies within their life that can be applied to Colorguard. You can also rely on other experts for advice or ideas. Other adaptive sports and programs, such as your local Special Olympics or other adaptive sports. Social media, especially YouTube, Instagram, has some great ideas, and there are a lot of other influencers out there who have ideas on Colorguard specifically. And then also lean on other coaches for support. Ask all of your other coaches their experiences. If they have any advice, just make sure when you are reaching out to other people that you don't share any sensitive information with them, and that you make sure you ask permission from your performer if you are reaching out to others for advice on their situation. All right, we'll go into some adaptive strategies and techniques. So the following sections will be broken down into different categories based on different needs and difficulties. These include sensory, motor, thinking, visual, auditory, and social. Just as an overview, your overall approach to coaching and supporting your performer does not necessarily change. Your main goal is still teaching and supporting participation in Colorguard. The biggest recommendations, though, are to have increased patience, an increase in understanding, and repetition is key. So some overall teaching strategies: chunking and repetition. This means breaking down skills into their most basic components and then slowly building up to the full skill. We do a lot of these strategies anyway without even knowing. So chunking can even be when you are teaching a new toss. You start with your hand position, and then you go through the checkpoints and the release points before you even start to toss. So same rules apply to chunking, essentially. And then repetition, doing the same thing over and over again to help build that connection and to help with memory. You also want to organize the learning environment. So this means setting up your environment to encourage success and focus. So this means providing schedules. If you're working on flag, make sure the rifles are away to limit distractions. If you're able to have Colorguard practice away from any other distractions, such as different sections or the band playing or things like that. And then creating patterns and routines. So structure and predictability help performers understand the expectations and to help build independence. So if you do the same warm-up every time, the same cool down every time, it helps promote that independence. And then also this can include having a schedule for performers for game days to help with those expectations and to understand what's happening throughout that day. You also want to encourage attention and engagement. So this just means before you start giving instruction or teaching, make sure your attention is on you. You can also use a variety of teaching styles. So this may be the use of videos. I recommend videos from the front and back when you're teaching choreography. And then even including written out count structures for those that are more of a learner who needs to see it written out and they might not be as much of a visual learner. And then also including a small group teaching styles if possible, where you, instead of teaching to your full guard, maybe you pull 5 or 8 members at a time to teach. And then hand over hand. This is physically guiding the performer with your own hands to demonstrate the correct technique. Always ask permission before touching your performers, but if they're having trouble getting a certain skill or learning something new, having your hands over theirs can help learn pathways, learn hand positioning, things like that. And then one-step simple instructions. This means breaking down your directions into the simplest steps and giving one at a time. So instead of saying, go get your flag and go to the first set, you would say, go get your flag, wait for that step to be done, and then say, okay, now go to your first step. So, sensory. Sensory registration is a person's ability to notice different sensory stimuli within their environment. So, this means noticing other people around them, noticing if they have their makeup or food smudged on their face. They may not hear people talking to them when they're in a crowded room with a lot of people talking. Sensory regulation is a person's ability to manage all these different sensory stimuli and then organize them within themselves. So, for some people with lower sensory registration, they may become overwhelmed in an environment that's super busy. If there's a lot of bright lights, if there's a lot of people talking, if there's a lot of loud noises, sometimes a person can have difficulty processing all this sensory stimuli. These are some specific strategies that you can use. So the following charts in this section break it down based on observations you may see within your performer, and then different strategies you can use to help. So go ahead and review these. Motor components. One motor component is grip. This is a person's ability to hold on to their equipment. Muscle endurance is how long a person may be able to use their equipment, dance, or participate before their muscles become too tired. And then there's also the use of mobility devices. This may be a wheelchair, a walker, things along that line. Again, these are some common observations you may see. If your performer is dropping equipment a lot or has trouble holding on to it, things such as grip tape or universal cuffs may be beneficial. I have a video in my YouTube that describes universal cuffs. So go ahead and look at that if your performer has any difficulty holding on or grasping objects. And then also I have a video on seated choreography. This is beneficial for any performers who use a wheelchair or cannot stand during choreography. Typically, choreography in the overhead or the 45-degree planes are best for this. And then some ribbons or swing flags may be beneficial if your performer has trouble with endurance or has lower muscle tone. And then, like I said earlier, just make sure that costumes work with any braces or orthotics they may need. So thinking skills are what we refer to as cognition. This may be learning new choreography, remembering choreography, following directions, or following a schedule. If your performer is having difficulty remembering choreography, it may be beneficial for you to mirror the choreography on the sidelines. Again, single steps directions are very beneficial for any performer that's having trouble following directions. And then make sure you accommodate different learning styles. This can include the videos, having written out structures, and then also providing a visual schedule for performers who may have difficulty with attention or memory. And again, repetition and hand-over-hand support can also help with these. So some visual strategies. Vision impacts our ability to see the equipment, move within our environment, and learning new choreography as well. So this can include tracking equipment in the air, finding drill spots, or learning new choreography. So for performers that have trouble seeing the equipment in the air or may have trouble seeing where to grab their equipment, I recommend using high contrast cheater tapes. So typically our cheater tapes are white, and this can be a little difficult to see on a silver pole or against a white gym ceiling and clouds. It's just difficulty to track the white. So instead, you can use a high contrast color such as purple or even bright orange can help differentiate between the ceiling and the pole. This can also apply for drill. So when learning drill, I know some marching bands and guards do this anyway, where you put down either tape or a marker to know where to go from set to set when learning. This can also be applied even after the learning stage. So you as a coach can set out drill markers or spots on the field or on the floor before the performance so they know where to go. Doing it within color order is also super beneficial, so the performer knows to go from red to orange, from orange to yellow, and so on. For individuals that have either very limited vision or no vision, they may benefit from having a visual buddy, which is someone guiding them along from set to set. You want to make sure that, again, before you touch any performers, that you get permission and go ahead and let them know you're there. It can be really disorientating to have someone come up behind you when you can't see and grab onto your arm or such. And then remember, even when you are teaching new choreography, to make sure that you give some visual strategies. When you are teaching, if someone has limited vision, encourage them to be in the front row, or if you can, go ahead and teach them one-on-one, or as you're teaching, make sure you're giving a visual description of what you're doing. This can include saying hand placements, make sure you're saying left hand, right hand, thumb up or thumb down, things like that. So, auditory strategies are beneficial for people who are hard of hearing or deaf individuals. This can impact hearing choreography videos or judges' tapes, hearing instructions during practices, or hearing the music or the band. So, if you are providing videos, whether that's judges' tapes or videos of you doing choreography, make sure you have closed captioning on those videos. YouTube does this for you through the use of AI. So when you are uploading any videos, all you have to do is check that setting and it'll do it for you. So it's super convenient. Not all performers who are deaf or hard of hearing use ASL, which is American Sign Language, but it can still be beneficial for you and your performer to either use ASL or come up with your own hand signals for common instructions. This can include phrases such as water, break, bring it in, one more time, things like that. Some performers with hearing aids or other hearing devices, you may be able to input music right into their device. So this may be beneficial during practices or during a competition setting. It can be difficult to hear within a gym setting specifically due to all the echoes. And then again, if your performer is having difficulty hearing the music, try to position them in front of a drum major or have another performer in front of them so they can stay on beat and know where they are in the music. And then some social strategies. These help both your performer with differing needs and the rest of your team with social integration and social acceptance. So, peer mentors, this is beneficial in general to anyone on your team. This is similar to kind of a big and littles, if anyone's done that. Um, but performers are learning from performers like them rather than, say, from a coach or another adult. This may be a captain or someone in a similar situation as them, or say you have a performer who's having trouble learning 45s. You can send them to a performer who also had trouble learning 45s but was able to overcome it. Sometimes learning from a peer is more beneficial than learning from an adult for some people. And then buddy system is along the same lines. This is assigning a partner that you know the performer can go to and rely on for questions. Some people may have difficulty or be a little nervous going up to adults for questions. So this helps to reduce any anxiety for performers. And then a lot of schools have a partners club. This connects special education students with other students who are looking to assist them. And a lot of Partners Club members may already be involved in color guard or marching band and would love to connect. And then partner choreography. This allows you to showcase talents and layer different levels of abilities within performers to performers. So whether that's half the guard tossing while other half does movement underneath, things like that. So some adaptive and alternative equipment options. Some modifications may be made to common equipment you already have. For the flag, instead of using a 6-foot pole, you could go down to a 5-foot pole. Also, the material, instead of using metal, you may want to use plastic if your performer has difficulty with muscle endurance and strength. And then the length of the material in silk. So super long swing flags tend to get heavy. And then also screen printed flags tend to be a little lighter than, say, sewn flags. Pom-poms, universal cuffs may be attached to help with gripping onto pom-poms. And then if your performer has any sensory aversions to the pom-poms touching their hands, you can use gloves to help mitigate that. And then weapons, the material and the size. If your performer has difficulty with strength, it may be beneficial to get a shorter rifle, or even you can do plastic sabers instead of metal sabers, or the use of air blades. And then contrasting tape colors and cheater tapes can be applied to weapons as well. If your performer is having difficulty using any of the typical color guard equipment, um, ribbons are a great lightweight option. And then always use of props as well. Just make sure that you always are giving your performer full participation and meeting that just right challenge. So we'll go through some case studies. So case study 1, you are the coach of an independent winter guard and you have a member who's 20 years old with Down syndrome. They're having trouble remembering choreography and they tend to get tired quickly when spinning heavy equipment. So I'll give you a second, go ahead and pause here and kind of think to yourself, who would you want to ask questions to and why? What questions would you want to ask? And based on the scenario, what may be some adaptive recommendations to suggest and why? Okay, so asking questions. It's super important to obviously ask your performer what any recommendations they have, what their specific needs or concerns are. However, you also want to include their parent or caregiver in this discussion. Even though they are 20 years old, they do have Down syndrome, which tends to have cognitive disabilities associated with it. So if they have cognitive delays, you want to make sure you include their parents or their caregivers in that discussion. If the performer and their caregiver is willing, you can also discuss with any medical staff or therapists who may be willing to give you some insight as well. And then what questions, you want to make sure you ask them what their goals are for color guard, what they want to get out of the activity. And then also if they have any specific concerns or questions they have about being able to perform or anything that goes along with color guard. And then based on the scenario, what may be some adaptive recommendations? So depending on the individual and depending on what you find out during your discussions with them and their caregivers, you may want to use some cognitive strategies to help with remembering choreography. This may include mirroring choreography, providing videos, and then providing those visual schedules and reminders. And then they may also have difficulty with spinning super heavy equipment for long periods of time. So you may want to look into the use of alternative equipment or equipment modifications as well. And our second case study, you are the coach of a high school fall program and have a student who uses a wheelchair. They had a traumatic brain injury earlier in their life and they cannot walk. They also have trouble holding onto objects for long periods of time. So go ahead and pause here and give those questions a think. Okay, so who would you want to ask questions to and why? So because they are a high schooler, they are still a minor. So you want to make sure you include the performer and their parents or caregivers in any discussions. And then again, with the questions you want to ask, you always want to ask their goals. You want to ask any experience that they have, and then any concerns or questions they may have, or ask what other relevant information they may want to share with you to make their participation in color guard successful. And then with traumatic brain injuries, it can have a varying effect on needs and performance and things like that. Um, they may have difficulty with the use of their hands or arms. So you may want to look into lighter weight options or some modifications to equipment. Also, because they're in a wheelchair, you may want to go ahead and look at that video I posted on seated choreography to give you some ideas on how to adapt choreography to be seated. Like I said, anything in the 45-degree plane and overhead planes are easiest. Um, Traumatic brain injuries can also be associated with some visual issues. So they may want to use some of those visual strategies as well. And then you may also see some difficulty with remembering choreography or learning new skills. So those thinking skill strategies could be beneficial to them as well. So these QR codes here are access to additional resources I created. The full resource guide goes in depth onto all different strategies and the benefits of inclusion and things like that. The quick guide is a quicker reference to that full resource guide. It's more easy for on the go or if you're trying to look at something quick. And then the Amazon equipment list, I went ahead and made a list of all these different adaptive equipments that I've been referencing. So you can go on there and see the specific links and how to order them. And then video resources will send you to my YouTube page where I have videos on seated choreography, ribbon use, and adaptive cuff use. Okay, so it's time for our post survey. So that same survey you were working on earlier, that next page is your post survey. Should only take about 3 minutes, but if you're willing, please go ahead and complete that survey just to let me know what you thought of the education and how beneficial it was for you. Great, thank you all so much.